It's 4:49, and in your health headlines this morning, CDC data shows Iowa currently has a very high level of influenza activity. In fact, about 38% of PCR tests were positive for the flu the week of February 8th, according to the Iowa Department of Health and Human Services. Reporter Alex Fulton tells us how the rising number of flu cases is leading hospitals to adapt.
So the University of Iowa is seeing a lot of inpatients.
Both Iowa Healthcare
It has been incredibly busy recently with influenza A.
and Unity Point Health are reporting high numbers of flu cases, including hospitalizations. No one is immune, and people both young and old are being hospitalized. Unity Point nurse practitioner Janae Brown says that lower vaccination rates could be a contributing factor.
I feel like this year I've had more hesitancy towards immunizations than I've had in the past. And I don't know if people are getting exhausted of all the shots or what's going on there.
This graph from the Iowa Department of Health and Human Services shows only about 27% of Iowans ages 6 months to 8 years have gotten vaccinated this season. That's almost 30% lower than the 2020-2021 season. Dr. John Rovers with the Iowa Public Health Association stresses that it's not too late to receive a flu vaccine.
If you do come down with something serious like flu, what they'll do is the flu that you come down with is going to be less serious. You're less likely to wind up in the hospital. You're less likely to die.
Medical professionals say that message is especially important to remember because flu season is far from over.
Despite it feeling like everybody around us has already gotten sick, we still have the tail end of the season to look forward to.
The flu vaccine takes 2 weeks to become effective, which is another reason why doctors recommend getting it sooner rather than later.
The Illinois Department of Public Health says over 9% of all hospital admissions the first week of February were due to the flu, with 30% of tests coming back positive.